The next technique that I'm going to demonstrate is how to construct a teardrop pad for a Morton's neuroma. Remember, Morton's neuroma is it pushing on the interdigital nerves. And so using a felt pad, we're going to create a teardrop shape. And the point of that teardrop is going to go towards the toes, unlike the metatarsal arch pad where the point goes towards the heel. So you're using the teardrop pad to provide some pressure to splay apart, to push apart the two metatarsals that are affected. So if they're having numbness and tingling in between their second and third toes, we would apply the teardrop pad directly in between those two toes, as you can see here. If it were between the third and the fourth, we would move the pad over. The pad is going right down in between. The length of the pad, it should go, here's my MTPJ, so it should be at least longer than that. Starts to go into the arch a little bit, but not all the way down your foot. And the tip of your teardrop should be ending right about where their toes actually separate. So it's a narrow shape, and then it bulges a little bit into the teardrop. So then when I put my foot down, I feel that, and it's going to splay apart these two joints, taking some pressure off of the nerve being affected. So you would adhere it if we're using, this is felt again. I have adhesive felt here, so it's currently adhered. I would also add some tape wrap or something else to add to the security of that pad being in the right spot and staying in that correct spot. So the teardrop pad, we are aiming for right in between the two affected metatarsals. Some of the things I commonly see are teardrops that look like this. This teardrop is almost the size of my whole foot. So if it's not narrow enough at the end, it's not going to really do a good job splaying apart those metatarsals. So you want to have your teardrop be the correct size for the foot that you're putting it on. So for my foot, about this big. So notice kind of landmarks wise, it's going down beyond the first metatarsal, but really not far into the arch at all.